Swollen feet, known as edema, foot or ankle. There are many causes of swollen feet, but one of the most common is overuse. People who stand for extended periods of time, for example, may notice that their feet become painful and swollen at the end of the day. Sometimes swelling does not go down overnight, and treatment is needed. In most, medical evaluations are not necessary, although it is important to see a physician. If swelling persists for more than a week with no obvious explanation, luckily, there are many steps that you can take at home to relieve symptoms and pain and reduce swelling. Elevation. Whenever you suffer from inflammation, elevating the affected area is a good way to decrease the swelling. Luckily, swollen feet are easy to elevate. When use a pillow to prop your feet up so that the blood does not pool. If you are suffering from severe swelling, you may want to try this technique overnight. Use pillows or blankets to create an incline at the foot of your bed. Your feet should rest above your heart to promote drainage and circulation. Taking NSAIDs, which are medications that you get before elevating your feet, should help to speed the recovery time. But also, these medications could also be causing your inflammation, and if this persists, see a physician and ask him about the medications that you are taking. Heat and ice. Using heat and ice in combination can accelerate recovery time for swollen feet. To use this therapy, fill 2 foot baths with water. One should contain warm water and the other one should contain ice-cold water. First, submerge your feet in the warm water, making sure it rises above the ankle. After 5 minutes, remove your feet and insert them into the cold water. You should only keep them submerged in the cold water for 1 minute before removing and drying completely. This combination of hot and cold therapy will decrease inflammation and allow you to walk without pain more quickly. Epsom salts. We all know what Epsom salts is. Epsom salts are always a popular home remedy thanks to their soothing properties. These salts have many purposes, but reducing inflammation is one of the most common. To properly use Epsom salts, you should fill a bathtub or foot bath with warm water. Then, add 1 or 2 cups of salts. Soak the affected area for 20 minutes. The salts are made from magnesium, which is a naturally anti-inflammatory. Soaking your feet in an Epsom salt soak is the sure bring relief to tired, aching feet, as they absorb all the healing properties contained in magnesium. Compression socks. If a swollen feet are a regular occurrence, compression socks may be the answer. Many professional athletes turn to compression gear to help them walk through overuse injuries and strains. These types of socks increase blood flow by forcing the veins to contract. When feet become swollen, it is typically because standing for long periods of time or general overuse has caused blood to pool in them. This means the veins have become distended to hold the blood. Compression socks force the veins to return to their normal size, reducing both inflammation and pain. Ginger is another home remedy for swollen feet. It also has anti-inflammatory properties, but more importantly, it can help to reduce sodium levels in the body. Since sodium is one of the primary causes of inflammation, this can be very beneficial. There are ways to use ginger, from making paste to drinking ginger tea. For swollen feet, however, is the most effective way to gently rub your feet with ginger oil, allowing it to absorb directly into the skin. Doing this 3 times a day will decrease inflammation and allow feet to return to normal in just a few days. And last but not least, although it may be painful at first, exercise can help to relieve foot inflammation. Most often, the cause of swollen feet is standing for too long. Walking and stretching the foot can help to keep circulation flowing, even though it requires being on your feet for those who have to stand in one place for long periods of time, like cashiers or hairdressers, it is important to stretch the foot muscle regularly. At least once per hour, you should lift one leg at a time behind you and gently stretch the arch of your foot. This will keep the foot and blood flowing and reduce swelling, although it will not eliminate it. In the end, if these remedies don't help, seek your doctor and ask him about the medications you are taking, as this could contribute to your problem.